Thank you very much for the opportunity to speak to FDA. My name is Paul Conway. I serve as Chair of Policy and Global Affairs for the American Association of Kidney Patients, the largest kidney patient organization in the United States. I'm a 47-year kidney patient who has 27 years of experience with living with a kidney transplant and 3 years of home dialysis experience. Like many patients that AAKP represents and collaborates with in other organizations, we're intensely interested in advancements in technologies and innovations that allow patients to be independent and to pursue their aspirations, including part-time or full-time work. The issue of a home-based health hub is very important from our perspective because it completes the arc of innovation that we've seen over the past 10 or 15 years through new devices that allow patients to do dialysis at home, to be monitored remotely, and other technologies, including wearables with sensors that provide other information to healthcare providers. But I wanted to touch on a couple of domains and a few cautions that are important. In terms of context, this particular issue is important when you consider not just the innovations that have occurred in the past 5 or 10 years, to the credit of the FDA, understanding patient burden and patient need and responding to it, but especially in the aftermath of the highest peaks of COVID and the understanding that COVID is still a threat to the kidney population. The kidney population, in terms of dialysis patients and in terms of transplant patients, according to the US renal data system, experienced among the highest mortality rates of any population in the United States. The risk goes on. So as we take the lessons of COVID and the flexibilities that were granted by CMS and other agencies that impacted telemedicine, we have to keep in mind how are we positioning patients who are most at risk for the next pandemic or the next natural disaster or the next national emergency. And those types of factors should come into the FDA's thinking about how devices would work and how home as a health hub could actually benefit patients in these different types of circumstances. So we've made a lot of advancements. When you get more granular, the other thing that we're seeing is many of the waivers in telemedicine have stuck, and they've either stuck through agency decisions or through congressional interests and upcoming legislation that will make them more permanent, meaning telemedicine and remote medicine is more a fixture on the landscape today than it was before COVID. The other thing that FDA should be aware of is that state Medicaid programs, those things that are under the discretion of governors across the United States, are also taking a look at new technologies. Big states like California and Texas are taking a look at how to pay for technologies that allow more interaction with doctors and patients in their household based on new devices for many different types of factors and many different disease indicators. That's a good thing. We see that as a further institutionalization of these types of technologies. The other thing that's important to keep in mind is what will the future look like? So in the kidney space, we're taking a look and we're seeing innovations move forward on artificial kidney development. That includes wearables, artificial implantables, bioengineered kidneys, and the future of xenotransplantation. I bring that up because in each one of those situations, you're looking at the lead innovators in the space trying to figure out what it would be like to monitor those types of kidney replacement therapies remotely, and that would mean home-based. The other thing that we would raise to you is that when these things are considered, whether this falls directly into FDA's realm or not, they're important. There are some potential barriers here. One is, what is the readiness of the healthcare workforce? We don't believe that should be determinative to FDA's decision-making, but you should be aware that oftentimes patients will demand devices, and the workforces and the medical professionals, with no discredit to them, are simply not keeping pace with technology. That's an important factor to keep in mind. Again, we don't believe it should slow it down, but you should be aware of it. The good news about that is the American Board of Internal Medicine, just in the past year, has updated its credentialing standards and criteria so that nephrologists have to have a greater understanding and demonstrate greater competence in things like home dialysis care and peritoneal dialysis. That's a great thing, because if the professions are not aligning with the future of technologies, we have a problem. One of the other things that I would raise are concerns that have been brought forward before the Patient Engagement Advisory Committee of the FDA, which I've had the honor to chair for the past several years. And those are related to technology vulnerabilities and patient privacy. And so as you take a look at home as a health-based hub, that's great. What is the safety of the devices that are being brought in or used at the home in terms of intrusion or hacking? And the other area that we would always be concerned about is who owns the data, what are the data arrangements, and what are the disclosure arrangements in language that are used for patients, and is it understandable? Are companies actually disclosing how the information would be used, and more importantly, what information they may want to collect that's not readily evident from the device itself? For example, if it collects more data than the patient might be aware of, that needs to be put in consent. The last thing that I would raise is that we have a concern about mission creep. And let me just mention what this is. So if we're viewing home as a healthcare hub, and we have technologies that can go in there and patients can be more independent and perhaps do more medical procedures independently based on a suite of devices, we would be concerned that there would be any effort by government to define what a quote safe home health hub would be, and whether or not government introduces other factors that violate a patient's privacy or get more intrusive about what goes on in their household. Number of people who live in the house, the amount of energy that the household uses, anything that would go beyond the scope of an actual medical treatment in a home. And I think that would have to be something that government needs to be very clear about and engage stakeholders on. The last thing I will mention is this. We appreciate FDA reaching out proactively to patients. We are very, very strong on the principle of patient care choice. And I have to tell you that patients want more technologies in their home, and they've demonstrated a level of competency, I think, that has surprised many medical professionals. We would strongly encourage FDA to work with other federal stakeholders and other federal career civil servants in the agencies that are looking at these types of devices for different reasons. For example, the Office of Disability Employment Policy at the U.S. Department of Labor. They have always leaned forward on behalf of employees and potential employees with physical or intellectual disabilities. And there is a whole argument to be made that home as a health hub helps those who oftentimes are not considered, or the workforce not offered an opportunity to participate fully. The other agency we'd encourage you to talk to is the Department of Defense, because some of the technologies that they are looking at through the Congressionally Directed Medical Research Program and in other areas have potential applications or may give you a sign of what's coming. And we think they're a good data source. The other agency we think that's important to talk to is FEMA, because FEMA is charged with a very big task, as FDA knows. But in terms of readiness nationally and anticipating natural and non-natural disasters or events, FEMA has a big stake in how homes are used in the readiness of a population to absorb the consequences of major disasters. And if you could actually have home as a health-based hub, you might actually make things more resilient and more portable for patients and take a load of burden off the healthcare system and healthcare workers. We appreciate the opportunity to share a few thoughts. There are many different domains that come into this, but we would consider AAKP a very strong advocate of more regulatory approvals or considerations. We appreciate bringing in the patient voice and the patient perspective. It will always be a balance among factors like safety, privacy, and a person's ability to absorb the technology and use it competently. But we would encourage FDA to keep an open mind and keep pushing for transparency and timely disclosure to patients throughout the process. So again, thank you very much for the opportunity to provide a comment. We appreciate it always. And thank you, FDA career staff, for always leaning forward to serve America and patients.